The Bigger Picture on BFM 89.9, the business station.
Good afternoon, it's The Bigger Picture and it's Mira Sivasudi. This year's World Kidney Day theme was Donate a Kidney for Life, Receive. And with me is Dr. Hirman Ismail. He's the Principal Assistant Director of the Transplantation Unit Medical Development Division of the Ministry of Health Malaysia. And we're exploring this whole topic of organ donation. Dr. Hirman, there can be nothing more worthwhile as a human being than to save the life of another. But in Malaysia, it has been an extremely low organ donation pledge rate. One of the lowest in the world, actually. Could you, share with me some of the reasons for this?
Well, actually, the low organ donation rate in Malaysia is actually a multifactorial issue. Right? It's actually partly because of the misconception about organ donation that has led people to having a negative feeling or afraid about organ donation. You see, organ donation is related to death, and probably that may be the reason why people are afraid to talk about it. When people are afraid to talk about something, it will definitely stop or hinder people from getting more and correct information about organ donation, and that will then further worsen the misconceptions. It's like a vicious cycle.
Right.
The misconception also happens when it comes to religious view on organ donation, especially among Muslim community in this country. Many are not aware or clear about fatwa or the Islamic rulings on organ donation, even though it has been issued as early as 1970, even before the Ministry of Health or HKL started its transplantation program. So our religious scholar has been quite proactive then, you see. So this misconception contributes to the lack of awareness in the society about the importance of organ donation. And it's actually for that reason the ministry is looking at ways on how to reduce or eliminate the misconception. For example, in our newly published educational materials, we tend to use more friendly images, appropriate layouts of our pamphlets, as to prevent people from having negative feelings towards organ donation. And we also want to create more positive perception and to convey a message there's nothing wrong about donating your organs. And organ donation is part of many ways to help people in need. And we have also recently published an information booklet and pamphlets on Islam and organ donation, which was published in collaboration with JAKIM, or Department of Islamic Development of Malaysia, that will help to hopefully to improve the misconception among Muslim community in this country.
Right. There are also cultural prejudices, which is often a deterrent. Are religious leaders, all of them, coming together in Malaysia? Just not the Muslims, the other religions?
That's right, the other religions
also,
as well. Yeah.
All of them are coming together. That's good to know. Do they, when you talk about organ donation, are kidneys the most wanted organ?
Yeah. Kidney is the most wanted organ.
Do we have numbers as to the need and the supply of people who have pledged?
At the moment, up to February 2012, there are as many as 15,000 people out there in Malaysia waiting for organ transplant. A majority of them are kidney patients, 15,120 of them are kidney patients. The rest waiting for liver, heart, lungs, and also heart-lung transplant.
Right. So about 15,000 kidneys needed?
Yeah. 15,000 kidneys needed.
Right. And how many people have pledged?
Up to February 2012, 190 Malaysians have pledged their organs.
190?
Yeah, 190,000.
190,000.
Sorry, 190,000. Sorry.
Right, that's fantastic. That's not bad at all.
That's not bad, but even though it represents only 0.68% of the total Malaysian population, so relatively the number is still low, but we have seen an increasing trend for the past few years. For example, in the last year, 2011, we recorded as many as 27,800 people who have pledged their organs last year. That was actually the highest recorded ever since 1997.
But you see this getting better every year?
Yeah, we see it's getting better.
More and more people. Pledging is different from being a donor.
Yeah.
What is the difference?
Well, when you pledge, it doesn't mean that you will donate your organs, Someone has to pass away first before someone can donate their organs, And the numbers of actual donors in the country is relatively very low as well. And last year we recorded about 47 deceased donors, in which 22 of them donated their kidneys.
Right. So 47 donors last year.
Yeah.
Have we had many living donors?
Living donors, last year we had recorded about 44 living donors.
That's not bad at all. That's very good.
Yeah, the number is increasing.
Yes, because I didn't think we had many living donors.
Yeah.
I think that's even another topic altogether. We'll come to that in a short while. But relatives often refuse to give consent to organ donation, and it's costing hundreds of lives a year in Britain. Right? Is that the same story here? Do you find that people pledge, but after they become brain dead or whatever, relatives are reluctant to consent to the organ donation?
Yes. Well, if we are sick, we may want our family members to help us, but there are cases where that is not possible. You see, family members themselves may refuse to donate because living donation involves risk. All right. It's a major procedure. It's a major surgery. Therefore, involve risk, including risk of dying, risk of getting post-operative complications, and it is not that our family members do not love us. If that is the case, refusal. But probably someone need to consider various factors before agreeing to living donation. Just take, for example, if I have a brother, all right, I need an organ. He may need to consider about his family, his children. They are. Just imagine if anything happened to him as a result to that particular procedure, who would take care of his wife or child, for example? As an elder brother, even though I desperately need an organ, I may not want to jeopardize him or subject him to certain risks. Therefore, that probably some of the reasons why family members
don't consent.
Yeah,
but even when, say, I pledge and then I, for unforeseen circumstances, let's hope this doesn't happen, but I become brain dead, but I have pledged already, but my family members do not want to consent to the organ donation, then it's so important, it's vital for me to inform family members that I have already pledged.
Yeah.
Right? Do you have that problem?
Yes, we do have lots of problems, and that's why when we do our campaigns, after someone pledged their organs, we always remind them to inform their family members that you have pledged to become a donor.
Right, and in Malaysia there are only 2 legal ways of getting a kidney, from a willing member, family member, and from a brain dead pledged organ donor. Am I correct?
That's correct.
So I cannot, out of my own free will, donate my organ to anyone. It has to be a family member?
It has to be a family member.
Failing which, I have to go to somebody on the registry.
Sorry?
On the register.
Well, I think before we go on further, let me clarify that there are 2 types of donation, living and also cadaveric or disease donation. And as far as the Ministry of Health is concerned, we encourage more disease donation as compared to living donation, because of the fact that living donation involves risk. All right, and with regards to living donation, we only allow donation within family members. If, let's say, someone would like to donate to someone who is not related, we don't encourage this, but if somebody insists, it has to be approved by the Ministry of Health first before it can be conducted, in hospitals.
What is the reason for that?
It's mainly because of ethical reasons. Because we don't want commercialization of organs to take place in this country. So that's the reason why we limit organ donation only within family members. At least genetic or emotional relationship with someone who is related to us may give some sort of reassurance that the motivation, the intention to donate is genuine.
Right. Yeah. And do you have an organ donation register?
Yes, we have.
How does it work?
Anyone can pledge their organs. There are 2 ways, basically 2 ways of pledging your organs. First, you can go online through our website www.agiftoflife.gov.my, or you can drop by in any of our hospitals and get the form and post the form to us.
And what is the current state of living organ donations in Malaysia? Is it a common practice? You said 44, which I am very impressed.
Okay.
Have you seen more people coming forward, living donors?
Yeah, we have seen an increasing trend for the past few years, but still the number is still considered to be low. All right. For example, if you look at the statistics, new kidney transplant rate in Malaysia is only about 4 transplant per million population. in every million Malaysians, only 4 transplants took place last 2 years. You see, and about 30% of transplant originated from deceased donors, and the rest came from living donors. However, those living donation, about more than half of them actually originated from commercially driven overseas transplant.
Right.
Yeah.
Okay, we'll come to that.
Right.
The transplant tourism. But how long is the average waiting time for people waiting for organs here, based on your register?
It's actually quite difficult to estimate the waiting time for organ transplant in Malaysia. This is partly because of the fact that the number of people waiting for organ transplant is very large. And as I mentioned, about 15,000. There's no way for us to objectively say to you, if I were to be diagnosed with kidney failure today, I cannot objectively say that you're going to wait for 5 years, 10 years, 15 years, probably longer than that. So,
right. And the only hope for patients to get off dialysis is to undergo a kidney transplant.
Yes.
From a suitable donor.
Yeah.
That is your only hope.
Yeah, kidney patients are more fortunate as compared to liver patients or heart patient, lung patient. They do not have alternative treatment unless transplantation.
Right.
So that's why the survival rate for this patient normally lower as compared to other organs.
The survival rate of kidney patients?
Oh no, so survival rate for heart and lung transplant patients, those waiting for organs for heart and lung transplant, normally they don't survive too long.
Right, because kidney you have dialysis to take you through. Coming up, we'll find out more about organ donation. Once again, if you have a question for Dr. Hirman, text 016-2019,000 or tweet BFM Radio.
Busy following Money Trail. BFM 89.9.
Good afternoon. It's the Bigger Picture and it's Mira Sivasodi. Dr. Hirman Ismail, Principal Assistant Director of Transplantation Unit, Medical Development Division, Ministry of Health, Malaysia. He's with me and we're discussing the topic of organ donation here in Malaysia. Dr. Hirman, are there, parts that a person can donate with negligible side effects?
Blood for blood transfusion and also for blood stem cell donation. So because the procedure is quite simple, taking blood.
So it's quite easy.
It's quite easy.
What factors must a person consider before becoming a living donor?
Well, generally living donors should be in good overall physical and also mental health. Certain medical conditions like poorly controlled diabetes, uncontrolled hypertension, HIV infection, hepatitis and other organ diseases will preclude someone from becoming a donor. Therefore, it is actually extremely important for someone, before becoming a donor, to inform the evaluation team, doctors and also nurses about one's physical and also mental health. And somebody need to complete a full medical and psychosocial evaluation and also be fully informed about the risks. And the decision to become a donor shall be voluntary and free of pressure and so guilt.
And psychosocial, evaluations is before. What about after? Do you provide counseling for donors, living donors, after the operation? We
do provide counseling. We do identify for any possible incidents of depression, for example. So if need be, the donor shall be referred to trained psychiatrists or psychologists to address those issues.
Will everybody have to go through it, or just some people?
No, normally we do for all living donors.
Right, to be on the safe side. What are the health complications one must expect after donating a kidney or a part of a liver, for an example?
Well, generally, most donors recover fully after the surgery and then can do normal activities within a few weeks after the surgery. Recovery period for liver donation is, of course, slightly longer than kidney donation. Well, generally, organ donation will not change your lifestyle in a big way. There's no evidence that it will change your life expectancy. And women can still have children. And as for kidney donation, it does not increase the risk of getting kidney disease in your other kidney. In fact, some people are born with only one kidney and live completely a normal life.
That's right, without even knowing that they only had one kidney. Who takes on the cost of post-operative medical care that is required by a living donor?
If the transplant were to be performed in a government hospital, the government will bear the cost. And in fact, the living donors are actually entitled to first-class admissions
Right.
Yeah.
What about if you're at work? I mean, living donors will have to take time off
Yeah.
for, post-op and recovery. Will they be compensated for this?
At the moment, I have to say that there's no formal arrangement for compensation for living donors. But if you are a public servant, you are actually entitled to unrecorded leave for up to maximum of 42 days.
Right.
In which you will be paid as usual, but you'll be given leave which is unrecorded, and
Okay.
you don't require a medical certificate, something like that.
Will living donors face higher medical insurance premiums for donating?
They should not actually, but there's no formal arrangement for that also, because as I mentioned that they normally will lead a normal life as healthy as a normal person.
And if you were saying there's a very stringent screening process before you become a living donor, what about a smoker, for an example? Can he become a living donor?
Smoking is not a contraindication for living donation, and as I mentioned that someone need to be screened for other associated diseases unless you have developed some kind of cardiovascular risk or cardiovascular conditions like hypertension or diabetes, then probably that would preclude you from donating.
And after donating, will the donors have to maintain a higher standard of health after the procedure, or do they continue living their life as normal?
They will just continue their life just as a normal person.
Would you still need living donors if every person in Malaysia chose to donate their organs after, they pass on? If the more Malaysians donate their organ after death, we wouldn't have to rely on living person to donate their organs. We certainly won't have to undergo difficult situation to ask our loved ones to risk their life by donating their organs. You see, so if we have more people donate their organ after death, definitely we will reduce the need for getting organs from the living person. And
that is our target.
That is what you're working towards.
Yeah.
And according to a study, female donors were more likely to find the overall process of being a living donor more stressful. In your opinion, why do you think that's the case?
I don't have an explanation to that because I'm not a psychiatrist.
Right.
But in general, that women tend to develop depression more compared to men. Probably because of psychological factors and hormonal factors as well. So
Right.
I don't have a clear explanation to that actually.
There is a debate in the UK where they want to have this opt-out policy for organ donation, i.e. everyone is in unless you choose to opt out. Do you think that is something that we should have here in Malaysia?
Okay, opting out system or presumed consent through legislative provision, as what is being practiced in certain countries like Spain, Australia, may not be the only solution to the shortage of organ supply. It has undeniably increased the donation rates in those countries. However, there are prerequisites before such system can be implemented here in this country. Your society needs to have a good level of awareness and acceptance towards organ donation first, and they have to be adequately informed about the issues, and this shall be done by providing them with good access to relevant information. If the society is not ready, or in other words, is not being appropriately informed about it, I'm afraid that it will cause negative impression to the campaign and probably will affect good outcome what we have achieved so far. So apart from having adequate access to information, the public shall also have good access to facility or opportunity to express their objection in case in case opting out system were to be implemented in this country. In other countries like UK and Australia, for example, they have talked about possibility of implementing opting out system for some considerable period of time, but still they have yet to implement it because of mixed opinion about such system among the public. So it's actually very important for various parties, not only the government, everyone, to improve level of awareness and acceptance first before such system can be implemented.
And
in
that's
this
what
country.
the Ministry of Health is moving towards. More awareness.
More awareness.
Yeah, so the whole opt-out thing isn't quite on the agenda at the moment.
That's right.
What about organ tourism? Now, this is something that's is a big no-no, transplant tourism. What are the consequences of us contributing to such a trade? we have, when put in that desperate situation, and Dr. Hirman, people will do anything. If somebody from India tells me I have an organ for you, I would probably fly out and get it. Now, what are the consequences of that?
The consequences is mainly it will increase the risk of people, especially the underprivileged society, to be affected or to be manipulated because of such practice. If we encourage people to go for commercial transplant overseas, there will be many people out there, not in this country, outside the country, will be affected in the sense that they will be manipulated for their organs. And this is not something that is somehow violates the principle of human rights, human dignity. I'm sure Malaysians would not want to see that happen in this country.
And what are your thoughts on patients finding kidney donors on the internet? I mean, this is going on.
Yeah, it's the same issue, organ commercialization, which definitely we should not encourage this.
So what do you advocate? More living donors? What would you advocate?
I would advocate for more disease donors as compared to living donation, because of the fact that, as I mentioned before, that living donors or donation involve certain risk, and we are actually subjecting people who are otherwise healthy to unnecessary risk. We don't want that to happen actually, but because of the desperateness, we don't have enough organs from the deceased donors, then probably we have no choice to get organs from the living person, especially from our relatives. So if you were to ask me, I think I would encourage more disease donation compared to living donation.
How do we pledge?
We pledge through online, www.giftoflife.gov.my, all right, or you can call up our toll free 1-800-889080, or you can drop by to any of our hospitals and get the form to pledge your organs.
And what happens? Do we get a card?
You will get a card. If you register online, we give us probably 2 or 3 weeks to deliver the cards to you.
And what happens if something happens to me and I have already pledged my organs? What do my family members do? What should they do in the event that anything happens to me?
They should inform the doctors taking care of your loved ones that this particular person has pledged their organs, and of course the doctors taking care of that person will refer the case to our National Transplant Resource Center for further action.
Time is crucial, Dr. Hirman, when it comes to harvesting these organs. These things have to be done really quickly, am I correct?
Yeah.
What is the time frame?
It depends on what types of organ to be procured or to be, harvested from someone. If heart, let's say for example, it has to be done within 6 hours. Liver within 12 hours, and kidney within 24 hours. So if let's say I take out a heart from someone, it has to be transplanted to the recipient within 6 hours.
Okay.
So we need to do it very, very fast.
That's very little time.
Yeah, that's why we need help from the police, from the army, mercy flights to transport the organs from any parts of the country to Klang Valley for transplantation. Okay,
and transplantation is only done in the Klang Valley?
Yeah, that's right. Because it's a highly specialized service, and not all hospitals can have the expertise of doing transplant. So at the moment we concentrate only in Klang Valley.
Okay, so that complicates things a little, especially if you're not living in the Klang Valley and you do need an organ.
Yeah.
Or vice versa. You're a donor but you're elsewhere.
Yeah.
Okay. So you're working with resources that you have, within your
That's
reach.
right.
Okay.
If we get more organs, probably we would develop more transplant centers.
Sure.
But the crucial issue is actually to get people to understand about the importance of organ donation, to donate their organs. Then when we have the quantum, the numbers, good numbers of donors, probably in the future we would probably have more transplant centers.
What is a comfortable number to have? Number of donors?
I can provide you that.
0.68%.
Okay, at the moment our our donation rate is about 0.6 donation per million population.
Okay.
If we can reach 1 donation per million population or 2 per million population, I think that can be a considerable target that we can try to achieve.
Wonderful.
Yeah.
Thank you very much for joining us.
Thank you very much.
Once again, if you'd like to pledge, that website giftoflife.gov.my or the toll-free number 1-800-88-9080. Thank you for joining us. Dr. Hirman Ismail, Principal Assistant Director of Transplantation Unit, Medical Development Division, Ministry of Health, Malaysia, on the Bigger Picture BFM 89.9.